Narcissistic personality disorder, or NPD, is a complex mental health condition. People with NPD often have an inflated sense of self-importance. They crave admiration. They lack empathy for others. NPD can significantly impact relationships and daily life. We need to understand NPD. It helps us recognize the signs. We can then support those who struggle with it. It also helps us set healthy boundaries. NPD is more than just being self-centered. It's a pattern of behavior. This pattern causes problems in various areas of life. These areas include work, relationships, and self-image. It's important to remember that NPD is a real disorder. It's not a choice. People with NPD need professional help to manage their condition. DSM-5-TR outlines specific criteria for diagnosing NPD. These criteria include a persistent pattern of grandiosity, a need for admiration, and a lack of empathy. People with NPD often exaggerate their achievements. They may have fantasies of unlimited success. They may believe they are superior to others. They might require constant praise and attention. Another key symptom is a lack of empathy. Individuals with NPD may struggle to recognize or identify with the feelings of others. They may exploit others to achieve their own goals. These symptoms can manifest in various ways. It's crucial to remember that not everyone with these traits has NPD. A formal diagnosis requires a comprehensive evaluation by a mental health professional. The exact causes of NPD are complex and not fully understood. Research suggests that both genetic and environmental factors play a role. Childhood experiences, particularly those related to attachment and parenting styles, are believed to be influential. Some studies suggest a genetic predisposition to NPD. This means that individuals with a family history of the disorder may be more likely to develop it themselves. However, having a genetic predisposition doesn't guarantee the development of NPD. Environmental factors, such as early childhood experiences, also contribute to the development of NPD. Overindulgent or neglectful parenting styles can play a role. Trauma, abuse, and other adverse childhood experiences can also increase the risk. It's important to note that NPD is a complex disorder with no single cause. It's likely a combination of genetic, environmental, and psychological factors that contribute to its development. The ripple effect: how NPD impacts lives. NPD can have a profound impact on individuals and their relationships. The constant need for admiration and lack of empathy can create strain in personal and professional settings. Individuals with NPD may struggle to maintain healthy relationships. They may have difficulty with intimacy and compromise. Their need for control and admiration can lead to conflicts with partners, friends, and family members. Professionally, NPD can hinder career advancement and job satisfaction. Individuals with NPD may have difficulty accepting criticism or working collaboratively. Their inflated sense of self-importance can create tension with colleagues and supervisors. The impact of NPD extends beyond the individual. Family members and loved ones often bear the brunt of the emotional burden. They may experience feelings of anger, resentment, and exhaustion. Real-life NPD stories from the couch. I've worked with many individuals with NPD over the years. One case involved a successful businessman named John. John was charming and charismatic, but he was also arrogant and dismissive of others. John's wife Sarah sought therapy because she felt emotionally drained. She loved John, but his constant need for praise and his inability to acknowledge her feelings were taking a toll on their marriage. Another case involved a young woman named Emily. Emily was beautiful and talented, but she was also deeply insecure. She craved attention and validation from others, often engaging in risky behaviors to get it. Emily's relationships were tumultuous and short-lived. She sabotaged them with her jealousy and possessiveness. She couldn't understand why her partners couldn't meet her insatiable need for attention. These are just two examples of how NPD can manifest in real life. Each case is unique, but they all share a common thread: the profound impact of NPD on individuals and their relationships. Navigating NPD treatment and coping strategies. While there is no quick fix for NPD, there are treatment options and coping strategies that can help individuals manage their condition and improve their quality of life. Therapy is often the cornerstone of NPD treatment. Psychotherapy, particularly schema therapy and transference-focused psychotherapy, can help individuals understand the root causes of their behavior and develop healthier coping mechanisms. Medication is not typically used to treat NPD itself, but it may be prescribed to address co-occurring conditions such as anxiety or depression. Coping strategies, such as mindfulness, stress reduction techniques, and self-care practices, can also be beneficial. These strategies can help individuals regulate their emotions, improve their self-awareness, and develop healthier relationships. It's important to remember that recovery from NPD is a journey, not a destination. It requires commitment, patience, and a willingness to confront uncomfortable truths. Finding hope and healing, a message of support. If you recognize yourself or someone you love in this description of NPD, it's important to remember that there is hope. NPD is a treatable condition. With the right support and resources, individuals with NPD can learn to manage their symptoms and live fulfilling lives. Seeking professional help is crucial. A qualified mental health professional can provide an accurate diagnosis, develop a personalized treatment plan, and offer ongoing support. Remember, you are not alone. NPD is a complex disorder, but it does not define you. With courage, compassion, and a commitment to change, healing and growth are possible.